Today I'm presenting on behalf of a team between King's and Groundswell, Martin Burrows and Rob Edgar in particular, but other people from Groundswell were also involved, and there's people in the room as well who might well bring me up and fill in some of the gaps. So together we've been evaluating Groundswell's work to develop some legal support for people who are homeless. So background to this work are the enormous legal challenges for many people who are homeless and how that can be intricately tied to the health inequalities that we see. And today I'm going to focus on sort of talking through some of that work and how Groundswell developed it and some of the evaluation we've done on it. And I hope Theresa May is watching the YouTube channel at home because I want to discuss this as well in relation to the hostile environment, the set of policies that the government has been promoting. Now, considering Theresa May's difficult week, it perhaps seems a little bit cruel to add my critical weight to what else is going on. And yet, power brings responsibility. So I will, at the risk of being cruel, I will, because I think this particular act of structural violence that is the hostile environment is perhaps in danger of being forgotten amidst everything that's going on in British society at the moment. So I'm sure many of you are familiar with Groundswell's HHPA service, but some summary details here. So the HHPA service principally involves one-to-one support to people who are homeless to attend healthcare appointments. And that support is provided by peers, so people with past experience of homelessness. And initial evaluations are suggesting that's having considerable impact, and separate to this study, we are doing an impact process and economic evaluation that's also funded by the NIHR, and that's Groundswell, myself at King's, and then colleagues at UCL and LSHTM, and maybe we can talk about that in questions afterwards if people are interested. So the HHPA service has really grown. So from 2010 when it first started to now being in action in 8 boroughs across London with 2,500 engagements in a year and moves to scale up across the UK. And the service has continued to develop through that time, linking to initiatives on Hep C, hospital discharge, mental health and women's health. And the latest area in which Groundswell are trying to develop HHPA is to try and respond to the legal needs of people who are homeless and to link that to the HHPA service and provide support to people who are peers and people who are clients of the peer service. I want to emphasize I can't take any credit for this at all. I'm an outside researcher, so I feel a bit of a fraud talking through this, but yeah, this would have been Martin, usually. So Groundswell has sought this development based on the experiences and needs of their peers, their peer advocates, and their clients. And that in turn builds on broader evidence for how poor health is associated with facing multiple legal problems. So people who are homeless are more likely to experience victimization by legal authorities, be the victims of crime, and be involved in illegal activities as a survival tactic, all of which we can link to poor health. And further, people who are homeless are less likely to access legally mandated services or benefits. So with that in mind, Groundswell are developing what they're calling the Building Livelihoods Programme with support from the Legal Education Foundation, or LEF. And Building Livelihoods is a 3-year pilot project. It's sort of got to the end of its first year, and it's aiming to provide legal support to the peer advocates and to clients through two main avenues. So recruiting progression advisors, so that's staff within Groundswell providing individual support, principally to peers, and then also sort of a range of training and workshops to peers to then help them help HHPA clients. Core context for the service is that there is relatively little evidence on what works to address the legal needs of people who are homeless. So we know the legal need is enormous, but quite how to respond is less known because schemes like this are little evaluated. And so there was little guidance for Groundswell to draw on in sort of developing the specific work of what they would do. So there's been a lot of experimenting going on that we're trying to evaluate. So in that context, a novel service Groundswell, little broader evidence to guide it, we developed a participatory formative evaluation. So we adopted principles of action research. So here, research is part of an ongoing reflective process and dialogue between researchers and practitioners. So identifying and addressing questions pertinent to delivery as we go along. And that replaces the more conventional approach of, say, outside researchers defining and answering a question. And we sought to be participatory as possible, so involved in the study design and implementation at different point were peers, staff from Groundswell, and researchers like myself. The fourth point on the slide summarizes the approach and aims. So we used a qualitative exploratory approach, reflecting the core questions around how is this new area of work experienced? So, in essence, is it acceptable? What is the context for it? How is it fitting in people's lives? And then a linked goal following a realist logic of trying to actually define the intervention in terms of how it works and with what potential impacts. So with that methodology, though, we collected data through the middle of 2018, and this mainly focused on semi-structured interviews with peers, with clients, and with stakeholders from across the sector. And then reflecting the action research approach, we sort of held regular meetings between the practitioners and the researchers and recorded those and used those as data as well. So now I'm going to talk through some findings. I'll focus on two main areas, reflecting limits on time, but we're going to be writing this up into a paper, so there'll be more discussion in that. The first area I want to talk about is the experiences of legal need. Actually, what is the intervention trying to respond to? So Groundswell, we did some work to try and understand more of the background. And then secondly, we'll look at some sort of initial experiences of the work of progression advisors and of the work peers are doing to support clients. So across interviews with clients, with peers, and with stakeholders, and in our meetings, the most prominent legal need related to immigration. So core context for this being the long-running challenges for people who are immigrants in the UK, but then also the more recent hostile environment policy. And the focus of this data tended to be around asylum and cases for support, and a sense, especially from stakeholders, as in this quote here, that the number of people facing these issues were growing, and in particular linked to the experiences of EU nationals facing deportation. And the other key topic that was explored, and often related to immigration, was entitlement to welfare and benefits. So current changes in the form of universal credit, for example, meant that securing and maintaining benefits is becoming increasingly difficult for people experiencing homelessness. A further common theme was the sheer complexity of legal need that clients and volunteers, peers, often face or have faced. This in terms of both the overlapping areas of law that are involved, but also the significant lengths of time for which these issues have been ongoing, and how people have been engaging with systems. So as in the quote here, this is from a Groundswell staff member talking about how hard it is to understand people's experiences, reflecting their multiple needs and how they've had long-running process of engagements with multiple services and systems, often bad ones, often being sent away with little actual response. So that people's legal needs are long-running and multiple means they can't be easily understood within just one short, perhaps 5-minute conversation. If people have been engaging with different authorities over many years, that can take a very long time to understand, and the detail is essential. Understanding everybody that somebody is engaged with is crucial to make sure you don't send people round their houses again and just add to their ongoing bad experiences of engaging with officialdom. And a consequence of that complexity was for people to report feeling overwhelmed. So people described to us not having motivation, not being bothered to respond to legal issues. But this in a context of overwhelming challenges that people are rarely equipped to respond to. So like this respondent here who sort of started talking about how they hadn't got the motivation. It's one of those things that if I don't know about something, I won't, I just can't be asked sometimes. So there's a lot of this language of not being motivated or not being asked. And that experience is no doubt true, but it's also a bit of a shorthand for language that we consider reflects other processes. So namely of our highly individualistic culture, across society, where if something isn't being done, if there's a continuing challenge, then it is, according to prevailing logics, the individual's fault. And the role of a system or social context is much less commonly recognized. So respondents, perhaps all of us, are used to talking in terms of motivation and being bothered rather than necessarily of being structurally oppressed by hostile environments. That's not how most of us talk about our day-to-day challenges. And so this kind of language, if we don't look at it critically, can just lead us to sort of individualize and blame individuals rather than sort of calling attention to the challenges in the system. And building on that complexity and then the hostile environment and austerity in particular is that there is little support available to address legal need. So as in the quote here, it's hard to access legal support for immigration, for family law, for employment. And then there's a sort of second order question of whether when you get support, do you actually get a good lawyer who can invest time and energy in your case? And lastly, just some key issues that came out about how those legal needs are directly related to health. So the first of how legal issues are directly causing homelessness and consequent ill health. So the quote here linked to the prominent theme on immigration just discussed. The second of how legal issues in the context of homelessness were impacting negatively on mental health. And then third of how legal issues, particularly around migration again, was affecting access to healthcare. So I'm going to turn now and consider how the intervention is actually experienced. So this is the work of the progression advisors and some of the training that was given to peers. And firstly, I'm going to focus on how peers experienced this work. So I'm just going to talk about three themes. The first two here, the first of how the advisors provided a lot of moral support and a safety net. So any particular legal knowledge, which was crucial, was actually embedded in or secondary to a process of feeling welcomed and accepted. So this being an antidote to the common experiences of rejection by multiple authorities. A second was how the advisors played a core role in linking people to support and making that support happen. So having time to explain to people what could or should happen and forcing accountability. So relatively simple or minor or quick acts like writing a letter to force accountability from, say, local government in terms of providing a house. And across this, it was clear that the progression advisors, so this is the new Groundswell staff, could do this by virtue of having a deep understanding of how London's multiple social, legal, and health systems operate. As in the presentation before, they knew the system formally but also informally, how to get round the official obstruction, the blocks in the bureaucracy, how to force accountability. And that moral support and brokering and signposting was ultimately made to work by a context of trust and the organizational culture of Groundswell. So as before, people's experiences are often very complex, and to understand those and respond appropriately requires trust and long-term relationships. Mainly because talking about your past challenges can be very distressing, and it's easier, perhaps only possible, to do that in a setting where there is trust. As in the quote here, uses Groundswell staff talking about the importance of that long-term connection. We do need some critical reflection on here, though. Within the study design, there's a lot of pressures to encourage particular sort of desirability bias. It's perhaps hard for Groundswell staff or peers to tell us about the problems with the service, and that's no doubt true. So we do need some critical distance. But nonetheless, this kind of theme came up across the data, across the interviews. And so this can tell us that this service is working in this way for some people. What our study can't tell us, and what we might need a separate study, is who doesn't like it. Who does this culture not work for? Who doesn't get trusted or who doesn't experience that trust? And I'll come back to that in discussion. So now turn to talk about the experiences of clients. So again, this was separate to the peer advocates. A key role here was in our peers building on their experiences, and then the sort of workshops that they had within Groundswell were able to sort of signpost their clients into other forms of support across London. So as in the quote here, so somebody is in a day centre, a hostel worker made a link, and the peer advocate was able to help that individual on the basis of their own experience. Very specific and targeted support. Again, relating to immigration. Extending the support, though, and in particular from progression advisors to clients, was, though, very difficult. And this has sort of came up quite a lot. And this mainly responded to the complexity of people's legal needs and then the challenges of communication. So the quote here illustrates this process. So Groundswell staff talking about the challenges in communication and how people's experiences have to be understood slowly and over time. This is not quick work. So this is quite a distinct experience between the peers and the clients. So peers already have a long-term relationship with the Groundswell staff within which these issues can be discussed. And that's very different for clients where it's a more episodic relationship and there's not been a chance to build trust. And also that legal need may be secondary. Somebody may have much more pressing health emergencies, for example, to respond to. So a quick summary of some core findings. So overall, that providing legal support is complex and that the additional resources from LEF, the Legal Education Foundation, were critical. And that for Groundswell, the support focuses much on moral support as it did on, say, technical legal expertise. And within that, there's a need to recognize how support relies on having specific, highly skilled, highly compassionate individuals providing that support. And from that, the evaluation suggests that legal support to peers linked to their work on the peer advocacy service is feasible with potential for linked benefits on health, and correspondingly perhaps should be a continued focus for work. But in contrast, support to clients of HHPA is perhaps less feasible. The complexity is perhaps too much to try and prioritize amidst attending to more urgent healthcare issues. So those findings, we need to understand them cautiously, given the methodology, but I can reflect on that in questions if that's useful. So now turn to discuss this in relation to some context, and as I said, the context of the hostile environment. So the hostile environment, this has been a signature policy for Theresa May, even if it's being overshadowed by current issues. And the aim was to create an environment that is difficult for people to navigate. Sadly, arguably by their own metrics, a real success story for the government of the day, maybe. What's interesting about this sort of statement, the aim is to create here in Britain a really hostile environment, is, as a social scientist, it's like seeing a smoking gun in someone's hand, because it's very rare for power to express itself so nakedly, and for sort of structural violence to be so clearly claimed. It makes analysis very easy. Power is usually much more covert. It's important to note, of course, though, that the hostile environment emerges from a long history, going back decades through new Labour policies as well, but arguably going back centuries. So I don't want to reduce it too much to this recent policy. And yet the hostile environment is also a very useful concept for describing the overall environment in which many people who are homeless are having to live and facing legal problems. So the notion of hostility can be expanded to include the experience of universal credit, which, as in other research we have going on, which I can talk about. It's also characterized by harsh organizational cultures. Cuts to legal aid, again, can be understood the same, sort of widely warned risk of reducing the potential for equity and justice. The same for the housing system, which is arguably set up to serve the interests of private landlords rather than allowing for, say, provision of council housing. So it's quite a useful concept. So maybe Theresa May has a future in social science, if not in politics. I don't mean to be quite so personal. A bit personal, but not quite so personal. So the hostile environment poses enormous challenges to Groundswell and all agencies in trying to address legal need and health. And it takes effect in the complexity people experience and then in the fracturing and declining support available. And it raises in particular an important question of integration. So integration is a core principle in how we might think we can secure an effective response to the health and social needs of people who are homeless and excluded. It's littered through almost all strategies. I mean, there is perhaps a side note that the term is so widely used, it's in danger of having no real meaning, just becoming a slogan we can all appeal to. But Groundswell's legal support can help provide this integration, to a point. It can help address complexity and link people into different services, and so bring together health, social, legal responses. And yet, hostility is in tension with the imperative to integrate. You know, the conditions of hostility make integration limited or impossible. And there's some perhaps important questions here. You know, what are the limits to integration? Should we be trying to integrate with a hostile system? Can you integrate with a hostile system? And that hostility, both short-term with recent policies, but also over the long term, is one core factor in Groundswell's challenges in not being able to meet the needs of clients as they thought they might, even if they have been able to meet the needs of peers. So services like Groundswell's can only do so much, especially in this environment. And so I guess we need to sort of try and prioritize action on this broader policy environment to take action on legal issues and ultimately health inequalities. So I'm going to finish there. Thank you for listening, and thank you to everyone involved in the evaluation at Groundswell, and then also to the Legal Education Foundation for their support for the programme on behalf of Groundswell.